Hey guys, what's up? If you're new here, my name is Aubrey. If you're not, welcome back. I am a registered nurse in the ER, and I thought it would be fun to do like a quick little get ready with me. Gonna do some quick makeup for some errands, but while we do that, I wanted to discuss some topics, including things that I wish somebody had told me before starting my journey as an ER nurse. There are a couple things that nursing school just won't teach you, and that's just real life. You're only gonna learn these things through those real life situations. So there are a couple topics that I want to discuss. And the first is going to be the mental and emotional toll that it takes on you working in the ER. So ER nursing is extremely intense. While everything you see on TV and in the movies is not real most of the time, it is very emotionally tolling because you see lots of traumas, lots of deaths, lots of sad things. And so you're going to see a lot of heartbreaking situations almost daily. Depending on where you work, what kind of a level trauma center you are, can be more, it can be less. But I feel like that's just something that you have to know before getting into that, because it can be a lot if you're not mentally prepared for it. Compassion fatigue and emotional burnout are real. Now, I think this happens in any specialty, but I think ER nursing, because of that emotional toll that it takes, it can be sometimes a little bit more. Something that's really important is you need to learn how to separate your work from your home life, because taking that home is just, it's not going to work in the long term. You're going to have to just learn how to separate those two and deal with those emotions. So there's a couple like coping strategies that have helped me with the burnout and the emotional toll, and that can include self-care days and doing face masks and really focusing on you, treating myself to a day, going out to a movie and some food, or hanging out with friends. And also something that's important is doing my schedule in a way where I can have multiple days off. And that's one good thing about self-scheduling is you can work like a Sunday, Monday, Tuesday, and then the next week you don't work till Thursday, Friday, Saturday. And that's a great way to take trips without having to use any PTO. And I feel like that has helped me a lot. I definitely like to cluster them and do my 3 shifts in a row, especially working night shift. I feel like that's just what works best for me. That's like a quick little hack to help you get more days off so you can go see family or just take more time off. This cold weather has really taken a toll on my skin, and I don't really know what to do to combat that. It seems like the nicer weather is hopefully very close, at least here in Texas. Now, I do want to preface by saying that with me giving all of these tips and things that I'm going to be discussing, it's not to deter anybody from doing ER nursing. It is strictly just stuff that I feel like isn't talked about a lot, and I surely would have liked to know these things beforehand, because it can definitely help you better prepare and kind of know what you're getting yourself into. I remember when I was in nursing school, I have a lot of people come from different floors of the hospitals and try to encourage new grads to work in med-surg. And it's just my opinion, but I feel like it is not necessary to start in med-surg. I think you can start in any specialty that you feel like works best for you. And I chose ER because it's super diverse. You see different patient populations, different acuities, and I feel like it's just been amazing, and I've learned so much. For my skincare, I've recently been using this bio oil and the La Roche-Posay moisturizer and mixing them, and then with the little Fenty Beauty like glow drops, mix it all together, and it looks really nice on the skin. Like I was saying, I have some errands to run today because next week we're going to Hawaii. So today is starting the trip prep. As a girl, trip prep can be fun, but it's also so stressful because you have your hair, you have your lashes, you have your nails, like wax. There's so many things that you have to do, but it's definitely super exciting. But if you're interested, I'm also going to be doing a trip prep video, so that should be out after this if you guys are interested. Topic number 2 is about time management. So in any nursing specialty, I feel like time management is everything, but in the ER, time management is everything. ER nursing, it's very fast paced. Like, you have to have that critical thinking, and that can be a little scary as a new grad, because I do feel like that critical thinking only comes with time. You have to learn to not doubt yourself and that gut instinct. You have to really learn how to prioritize that time management. Now, everyone does it differently. I know on the floors, a lot of people write it down. In the ER, you just don't have time for that. You don't have the luxury of following a perfect schedule. But the nice thing is that with time, that critical thinking becomes second nature. You know how to prioritize based on your patient acuity, and It's funny because there are some NCLEX questions that kind of prepare you for that. Like, this patient is on the call light and they need to go to the bathroom. This patient wants to leave AMA and they have a blood clot in their lung. And you have to just kind of figure out, you know, where you need to go first and what you need to do next. You've got an ambulance over here. You've got someone's family trying to talk to you. Very chaotic, and I have people ask me all the time, why did you choose this and why do you want to do it? Some days I don't really know, but then others it is super fulfilling and super rewarding. So some tips for how to stay organized. Like I said, people in the floor, they have their little cheat sheets of meds due at this time and this time, and that's what my preceptor actually taught me in the beginning. But if we're being honest, that's really hard to keep up with, especially at the hospital I work at currently. We're in pursuit to become a level 2 trauma, and things are just so fast paced. You can have a level 2 trauma ambulance coming in, you can have an ICU or IMC patient, and you've also got 2 other patients, or you've got a new patient coming in from the waiting room. So you just really have to prioritize based on acuity, and that will set you up for success, I promise. You don't need to go and discharge somebody that's stable before you go and see a new patient that is having chest pain and has previous stents, previous MI. So you just have to really think about those. And like I said, that will set you up for success and you will be great, and then it'll become second nature. Now, topic number 3 is nursing school did not prepare me for this at all. There are, like, you know, obviously the textbook things that you have to know, but the real life situations really is what teaches you the most. The textbooks don't teach you how to deal with aggressive patients, real life emergencies. That gut feeling is not something a textbook can teach you. You just learn that yourself, and you have to really learn how to advocate for yourself and your patient. Making those split-second decisions, that is not anything a textbook can teach you. You've got to learn that on your own, and that can be kind of scary. There is like a super steep learning curve in your first year as an ER nurse. The environment is extremely fast paced, and I feel like as a new grad, when you're still trying to learn that critical thinking and how to prioritize your care, that can be super stressful. But with the right support and the right colleagues, you should have people there to help you land your ambulance or to help you start a sepsis workup if you need. You've got to learn how to lean on your buddies, and don't be stubborn to ask for help, because it's going to take time, and having that support system really helps. You should never be afraid to ask questions. It is totally normal to make mistakes, and that's how you're going to learn. So don't be scared to go up to your charge nurse or ask a colleague for help, like I said. And if you work in a nice place, then they should be understanding. We all try to look out for our new grads and help them, because we have all been there. Don't be that person that you had as a preceptor in nursing school that was so mean and didn't help you. You couldn't ask questions. Be that person that you wish you had. Number 4 is how to deal with difficult patients. Not everyone is going to be rainbows and sunshines. You're going to have aggressive and angry patients, so you have to know how to deal with that. There are classes that they try to have you do as a new hire, but I still feel like that doesn't prepare you for the real life situation. You can have intoxicated patients. You can have patients high on multiple different drugs. You can have psych patients. You can have 4-point restraints. You can have a patient where you have to give Ativan. And I feel like in the moment that can be a little scary, because you also want to protect yourself. I personally really enjoy the psych patients. Psych is something that is kind of near and dear to my heart, just due to some family issues with that. But you just have to remember to stay calm. I feel like with psych patients especially, they really just want to be treated like a regular person and talked to. Don't talk down to them. They try to teach you to de-escalate the situation, but a lot of times these patients are not in the correct frame of mind to even de-escalate, and that's when you can try to get hurt. So just remember to keep yourself at a safe distance. Call your PD whenever you need to, and don't be in there alone for sure. With that also comes family members that are angry. I know that it can be easy to get frustrated yourself because you're busy, you're trying your best. It's not your fault that you don't have discharge paperwork. It's not your fault that this patient doesn't have pain meds, as you've advocated and messaged the doctor, and the doctor is just behind. But you are unfortunately, the face of it all. So you're the one that's going to take the brunt of that. You're the one that they're going to yell at and get upset at. You just have to learn how to communicate that to the patients, and if you need to, escalate it to your charge nurse or the PD. Like I said, never be scared to ask for help or ask for a coworker. It's definitely nice when you have a charge nurse who appreciates you making them aware of situations, because there are some that you can tell them, hey, I've got this going on, I might need a second or I might need a hand, and they don't really care. but that's not a good charge nurse. So I pray that everyone has an amazing charge nurse and support system, because that makes a huge, huge difference. Now, with saying that, that makes me get to another point, that interpersonal and communication skills are just as important as your clinical skills. You have to learn how to de-escalate the situation. You have to learn how to communicate to those angry or to those agitated patients, because it can be a split second and they turn and your life can be in jeopardy. Topic 5 is going to be the reality of short staffing in high pressure situations. Now, depending on your hospital, this short staffing can be in any department and not just the ER. But in our hospital, it is flu season, it is crazy season, busy season, which means we are holding. Now, if you're not healthcare, I'm sure you probably don't know what that means. Essentially, that means that the entire hospital is so full that all the patients that are coming through the ER that need to be admitted are waiting in the ER for a bed to become available upstairs. So that leaves us with no beds available for actual ER patients, and that can be super stressful. We had to open up our disaster area, which is essentially just a conference room with a bunch of chairs so that we can see patients. When we have 30 plus in the waiting room, it can be a little stressful, especially with not enough staff to work that. You end up never catching up. So with those high pressure situations, the ER is unpredictable. 1 second, you can be sitting, and we don't like to say the Q word, it's not ever quiet in the ER, but 1 second can be just fine, and then you've got a CPR coming through the front door, or something crazy where you have to just get up and get on your feet and think about how you're going to react to the situation. It is definitely overwhelming, but you have to remember to keep yourself centered and calm in these situations, or you're never going to be able to critically think, because you're too focused on everything else going on around you that you kind of forget, like, hey, I'm the person in charge. I need to figure out what to do, how to get this patient on a stretcher, how to, we need to start compressions, who's going to do meds, that kind of stuff. So you also have to learn how to set boundaries, not only for yourself, but for your patients, because at the end of the day, you're the advocate for the patient and the advocate for yourself to the doctors, to the other nurses, to your charge nurse, to the pharmacist. You are that advocate. And I feel like I used to be so scared to message the doctors or to talk to the doctors, but that just also comes with time and experience, because really nobody is better than each other, and you have to learn that you guys are a team, and that confidence will definitely come with time. Now, this next topic is near and dear to me. However, it won't be for much longer, but I still have learned so much and I'd like to share. So the next topic is going to be night shifts and burnout and how to survive. So adjusting to the night shift lifestyle can be definitely taxing and hard. It is super difficult. I really did not know what to expect, but it was much harder, and I feel like I still have not acclimated to this day, and I have been on night shift for a year and a half. So props to those people that it really works for and they do it long term, because I just feel like I unfortunately am not one of those. But there are a few things that you can do to make it a little bit easier. And the most important part is making sure that you have a healthy sleep schedule. So some people that I know, they just stay on night shift because on the night shift sleep schedule, even on their days off, but they don't have kids, and it's kind of just them. For me, I am a morning person, so let's say I work tomorrow, right? So I'm gonna go to work at 7 p.m. Usually on my first day, what I do is I sleep like normal the night before, try to wake up a little bit earlier, so wake up at like 6 a.m., go to the gym, get some stuff done around the house, eat breakfast, relax, watch TV, and then I'm in bed by 12, and I sleep from 12 to 4, and I wake up, and that's kind of how I get my body back into that sleep cycle. Now, the first day can be a little hard because, your body's still adjusting, but that's typically what I do. Coffee, energy drinks are really not good for you, but that's kind of what the night shift lives on. Meal prepping helps so much, because I gained a lot of weight when I first joined night shift, because I feel like you're really just so tired and everyone around you is ordering, so it's like, you want pizza? Yeah, I want pizza. I didn't cook anything. So meal prepping will really help you. Keeping a nice gym schedule will help you. That's been a little hard for me because I feel like I'm so tired on my days off. I feel like with night shift too, like that self-care is super important, whether it be, just waking up a little early to do a face mask or to curl your hair, put some makeup on before work just to make you feel a little bit better. There are definitely pros and cons to night shift though. I know it's a little bit different on the floors, because I saw a TikTok earlier today that was like, oh, why I'm staying on night shift, and it was because there was no family members and the patients are sleeping, but that does not apply to the ER. I would say one of the nice things about night shift is management isn't really there breathing down your neck. Not that that can be a bad thing, but depending on your management. Now, I know I've kind of mentioned a lot of things that sound negative, and like I said, I don't say any of this to sound negative or to scare anyone, but it is just kind of the reality. And I know I mentioned the stuff they show on TV is usually not very accurate. There was a show that I recently watched on HBO Max called The Pit, and I actually really liked the show. While it's not extremely accurate, it's probably one of the most accurate ones I've seen in a while, just because it's not like Grey's Anatomy where they focus on all the drama. They focus on the drama within the ER, which is really fun. So if you're interested in the ER, I definitely recommend watching The Pit. The only comment that I have is there's no respiratory, and second, they make it seem like the doctors do a lot more than they do hands-on. And I'm not hating or shading on the doctors, but a lot of the things that you see the nurses are the ones that end up doing and tasking. So that's just something to keep in mind. Okay, now all we have is mascara. Just a quick little simple look. But we're going to talk about the rewarding parts of being an ER nurse, because it is not all bad. So despite all the challenges, ER nursing is one of the most fulfilling things I've ever done. It definitely has its ups and downs, but when I look back and think about the patients that I impacted, it truly motivates me to keep going, and you have to kind of find that for yourself, because if you don't have that in a job, you're never going to be able to do it long term. And one of my favorite things is you get to see a diverse patient population. I've kind of talked about this multiple times. That's one of my favorite things. I get to see, we don't see pediatrics very often, but we do see pediatrics, we see adults, we see geriatrics. So it's kind of nice to see the whole like scope of patient population. And also you see different types of acuity. At our hospital, we have a fast track area for our level 4s. That's people with, they just need a quick x-ray, they've got a broken ankle, or they need flu COVID swabs, all the way up to level 1, level 2 trauma. And as a new grad, this can be a little overwhelming and scary, because you're like, how am I supposed to keep up with all of this? You will learn so much. I promise you will learn more than you ever realized, more than the textbooks could ever teach you. And you're essentially learning every single specialty in one. But don't be overwhelmed, don't be scared, don't doubt yourself. You're here for a reason. You passed the NCLEX, you passed nursing school, which is not easy. You did it, so don't be hard on yourself. Realize that you know more than you realize, and these small moments are what make the chaos worth it. Saving lives, the patient gratitude, having an amazing teamwork, those moments where you're holding a patient's hand and truly being for them. I really wouldn't trade my ER experience for anything. I'm so glad that as a new grad, I decided to go against what everybody else was doing and start in the ER, because I have learned so much and I feel better equipped to do anything now. I could be a flight nurse, I could change specialties if I wanted to. Really, the world is just your oyster, and I feel like personally starting out in the ER is an amazing experience. You also, even if you're not a new grad, you have nurses that come from the floor in the ICU that want to start out in ER, so you don't have to start out specifically as a new grad. There are definitely lots of pathways. They have residency. So if this is something that interests you, I totally recommend looking into it. ER nursing is so rewarding and exciting. Now, if you guys are also in healthcare, if you're not even just necessarily tech, just anybody in healthcare, if there are some things that you wished you had been told or, warned of before going into healthcare, whatever specialty you're in, if you're in ER, what are some things that you wish you had been told? Be sure to like, comment those things, and subscribe. And like I said, I'm going to be doing a trip prep video for our Hawaii trip. That's next week. I'm so excited. We have 8 days off in a row with no PTO. So we're going to Hawaii for a quick little weekend trip, and yeah, just stay tuned for that video. I hope you guys enjoyed this quick little informational video. I just kind of had the idea and thought it would be interesting to do while I get ready. So see you guys next video. I hope you enjoyed. Bye.